Good morning and welcome to our continuous teaching on mental health awareness. This is episode 7 if you're keeping score. I hope you're watching these. And we are, today's topic is going to be on what is mental health. And I also put in there us versus them. I will explain that to you. So let's get some definitions of what is mental health. And I'm going to put my glasses on for this for just a second here. Some define or have the definition emphasizing that mental health is the psychological well-being, or as some would say, absence of mental health problems. For example, the World Health Organization has defined mental health as mental health can be conceptualized as the state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. A person who has good mental health will feel in control of their emotions, good cognitive function, and will have positive interactions with the people around him or her. To define that even more differently, a mental health disorder or mental health illness is a diagnosable illness, and there are different types of that, and we're going to be breaking down a lot of those types in future sessions. And a mental health problem is a broader term that includes both mental health disorders and symptoms of mental disorders. A better way that I like to explain it, and I've explained it this way for a number of years, is from a nurse's standpoint, is looking at somebody that can be acutely ill or chronically ill. Someone that becomes acutely ill, it's a rapid onset of symptoms that can be resolved in a short or long-term time, versus a chronic illness is something that the onset of symptoms comes gradually and there is no cure for it. You have the disorder, the disease, the condition for the duration, with times of exacerbation of the symptoms, and they're treated and getting the person to the highest level of functioning as you can with that chronic disorder. In the world of medicine, the medical world, some examples would be diabetes, COPD, which is chronic obstructive pulmonary disorder. There could be other, which includes emphysema. There could be other conditions or diagnoses that are chronic in nature. They're not going to get better according to medicine. There's no cure for them. There is control for them to get the patient at the best level that we can. Now, in behavior health, there's some of that too, but I'd like to, before I get into behavior health and talk about the comparisons, I'd like to take as an example a respiratory, for instance, as a continuum of the levels of sickness, and define the difference between that acute and the chronic, and then we'll compare that in the world of mental health. If a person gets a cold, it's a rapid onset of symptoms. I seem to get a cold whenever I travel, go figure. And good news is I haven't traveled for a long time, so I haven't had a lot of colds. But I say those airplanes are like a petri dish. You just they just collect bacteria and you recycle that air. And usually I'll pick up a cold, and if I'm not careful, and I do the best I can with the cold. Cold is it's a nuisance. It could be some colds and viruses can be worse, more serious than others, but most of the time, with a cold as a respiratory problem, I may have some coughing, some stuffiness, headaches. But if I take meds, drink lots of fluids, I get plenty of rest. I usually don't need to see a doctor. I don't need to be put on any prescription medication for a cold. It's something that I've learned through the years, like you have too, is to just roll with it and let it run its course, and do everything I can, either preventatively or after the symptoms occur, to be better. That cold also, there can be things that can turn into more of an infection and still considered acute, things like a pneumonia, where I get some infiltrates in the lungs. My air passages starts closing up. I get either bacterial or infection in my lungs, and it turns into a pneumonia that needs to be treated. Often needs to be treated by a physician, needs to be treated with medication, and in severe cases can show the need to be treated not only on an outpatient basis, but be treated in an inpatient setting to get some IVs in you, to just really work on that infection and get it out of your system before it gets systemic. And and depending on the severity of the pneumonia, is the severity of the treatment. And then respiratory wise, and I mentioned it before, respiratory wise, there are COPD, for instance, where it's a chronic pulmonary disorder. The lungs have been compromised, emphysema, and other examples of that could be where you get worse, and if not treated, it gets even worse. Maybe somebody has to be put on oxygen, and you'll have oxygen all the time. There may need to be hospitalized occasionally for it, in very intense treatment to make sure that the lungs are being treated, and for this chronic disorder. Now that's respiratory. Now let's compare it now to behavioral health. Behavioral health has some chronic disorders as well, and we'll talk more about this in episodes to come. For instance, they have schizophrenia, bipolar disorder are often considered a chronic disorder. If diagnosed properly, it's a disorder that's chronic for the chronic patient, and it more than likely will not go away. It is something that you have to, just like the COPD, it has exacerbations of the symptoms that needs to be treated, and often needs to be treated when severe cases in hospitalization. So that's where a psychiatric admission comes for somebody who has a psychotic break or a manic phase with bipolar disorder or schizophrenia. Then there are other things that are more acute. You can have acute depression, but usually depression is situational, and it's usually comes on with a often a rapid onset of symptoms within a period of time, or it could be a longer duration of symptoms. But when somebody becomes depressed, it's like that pneumonia. If it's not severe depression, it's a different story. But when it becomes severe depression, where the symptoms, like that severe symptoms of pneumonia, there gets to be trouble with that, and maybe you need to be hospitalized on medication to get past that. Maybe you're suicidal or unable to care for self or others. Hey, and then there's that cold. gone through some issues in behavioral health and comparison. We've gone through issues of grief and loss, and I'm depressed. I lost my job. I lost my income. I feel abandoned. I'm in an area of where I have the symptoms of depression, but maybe not diagnosable of depression. That is considered mental health problems. That's like a cold. And if you think about it, all of us have had mental health colds, so to speak, where we've had times where we may not need treatment, but maybe we need to rest, get some advice from our friends, get some encouragement, and we feel better. See, there's that spectrum of acute, low acuity, higher acuity, and the chronic issues that come with mental health. I would say that nearly everybody has had, unless you're just a miracle person, who has always had some sort of mental health problems in the past. So when we start talking about us and them, we have to take ownership that sometimes our problems is just like other people's problems with mental health, but it's maybe not as severe. So instead of saying they all have mental health problems, we're all in this together. Matter of fact, I said this a few weeks ago when we talked about statistics. 1 out of 5 Americans have a diagnosable behavioral health disorder. So that's a diagnosable disorder. And I would say that all of us at one point or another have problems. So when we break that down, that's why I'm really pushing and having mental health awareness sessions like I have today. I hope this has helped you out. I know there's a lot more I want to share, but I'm trying to make it in just short blocks of time, and this is even a little longer than I wanted, but I thought it would happen that way today, so please bear with me as we continue. And keep coming back next week for some more mental health awareness. This was number 7. Of course, next week will be number 8. And pass it on. Keep watching it. And thank you for joining me for Morning Moments, and may God richly bless you.